I'm Dr. Katherine McDermont. I'm a chiropractic neurologist. That means I have a Doctor of Chiropractic degree as well as postdoctorate training in functional neurology. Parents, coaches, and athletes should have an awareness about concussions because they're occurring at epidemic levels. In 2012, 3.8 million were reported in the United States. That's profound. Once you have a concussion, you're at greater risk for a second to occur. And this can mean long-lasting effects for athletes, especially young athletes whose brains are still maturing. Symptoms of a concussion can vary. It could be headaches to nausea, brain fog to sensitivity to light, sensitivity to sound, sleep disturbances. Fortunately, a lot of technology has been developed that also addresses how the brain has been impacted and can really look and measure objectively if the brain has been compromised. The great thing about having a baseline test is that if an athlete sustains a concussion, we're able to do that test again and compare side by side to really evaluate if there's been a compromise to function in addition to addressing symptoms that are taking place. This is an opportunity for the athlete to uncover weaknesses that they have because we are measuring objectively how they're performing. An athlete's going to want to know if they have poor reaction time or if they're having a difficulty with tracking the ball with their vision. It's an added bonus to be able to uncover these weaknesses and perhaps strengthen them before the season starts to even improve their performance, aside from protecting them from concussions. So if there's pressure from a coach, parent, or athlete to get the athlete back in the game, having baseline concussion assessments really gives us concrete information so that we can all be a team in making that decision about whether that child is ready to be back on the field safely. Because remember, once you've had a concussion, you're at greater risk for having a second concussion occur. Oftentimes, athletes spend months to even years suffering from post-concussion symptoms and suffering from the inability to fully function. Even though we are very successful at restoring function and rehabilitating our patients who suffer from head injury, our mission is really to educate the community on how we can prevent head injuries, as well as to educate on how to seek appropriate care when you suffer from a head injury. I am happy to be a resource for coaches, parents, and athletes in regards to prevention and treatment.